If you run an orthodontic practice in Australia, your insurance requirements reflect the clinical complexity of specialist dental work, the high value equipment required to deliver it, and the long term nature of the patient relationships at the center of your practice. Orthodontic treatment spans months and sometimes years. The outcomes are visible and significant to patients, and the clinical decisions made at the outset of a case shape the result throughout. Understanding what insurance you need and how it responds to the specific risks of specialist dental practice is important. Here is what cover orthodontic practices need, what it typically costs, and how to approach comparing policies. Professional indemnity or medical indemnity insurance is the most critical cover for orthodontists. It responds to claims arising from your clinical work, treatment that results in injury, outcomes that do not meet patient expectations, consent disputes, or allegations of clinical negligence. Specialist dental professional indemnity for orthodontists is available through dental association programs and specialist healthcare insurers. The level of cover required for an orthodontic specialist is typically higher than for a general dentist, reflecting the complexity and long-term nature of orthodontic treatment. Public liability insurance covers non-clinical injury and property damage on your practice premises. Patient and visitor injuries in your practice that are unrelated to clinical treatment are public liability matters distinct from your professional indemnity coverage. Practice contents and equipment insurance covers your clinical chairs, digital scanning technology, cone beam CT equipment, treatment planning software infrastructure, sterilization systems, and other high-value assets. Orthodontic practices have invested significantly in diagnostic and treatment technology, and appropriate contents cover ensures these assets are protected against damage, theft, and breakdown. Business interruption insurance covers revenue loss if an insured event forces your practice to close temporarily. For an orthodontic practice with a full schedule of active cases requiring regular appointments, an unplanned closure does not just cost today's appointment revenue, it creates a backlog of case management that is difficult to recover from quickly. Cyber liability insurance is worth considering for practices that hold patient records, treatment photographs, and clinical data electronically. A data breach affecting patient information has privacy law implications and potential compensation liability that traditional insurance does not cover. Workers' compensation is compulsory if you have clinical and administrative staff. Healthcare workplaces have specific obligations under workers' compensation legislation in each state and territory. What does it cost? Orthodontic professional indemnity premiums reflect the specialist nature of the work and are typically higher than general dental indemnity. Practice contents, business interruption, and public liability are additional annual costs. Work with an advisor who specializes in specialist dental or healthcare practice insurance. Use the free business insurance finder at Reliable Business Tools to find the right cover for your orthodontic practice. Answer a few questions and get matched with relevant options, no obligation.